Hi everyone, this lecture is going to be on neutrophil kinetics and causes of neutrophilia. In adult animals, neutrophils are primarily produced within the bone marrow, where they mature into segmented neutrophils that are released into blood. They then use the blood vessels as highways to get to their final destination within the tissues. Neutrophils typically spend about 5 days maturing in the bone marrow, 10 hours in circulation, and then roughly 1 to 2 days in the tissues before they undergo cell death. Within the bone marrow, neutrophils are broadly divided into those stages that can divide, called the proliferating pool, and those cells that cannot divide, called the maturation pool. Within the maturation pool, there's a subpool called the storage pool, which consists of mature neutrophils waiting to be released into circulation. In blood, there are also 2 pools of neutrophils. Those neutrophils that are free-flowing in the blood are within the circulating neutrophil pool, and those neutrophils that are loosely adhered to the endothelial cells are within the marginal pool. These marginal pool neutrophils can either return into the circulating pool, or they can undergo firm adhesion and migrate into the tissues. The circulating neutrophils and not the marginal neutrophils are the ones that are sampled during a blood draw. The 3 main causes of neutrophilia are excitement, stress, and inflammation. Excitement is caused by a rapid release of catecholamines, such as epinephrine, in a fight or flight response. Stress is caused by excessive glucocorticoids, such as cortisol. And inflammation is a result of inflammatory cytokines. Catecholamines that are released with a physiologic or excitement response cause an increased heart rate and also increased blood pressure. And these result in increased blood flow through the blood vessels. This increased blood flow physically washes the neutrophils from the marginal pool into the circulating pool. Since it's the circulating neutrophil pool that is sampled during a blood draw, it looks like the blood concentration of neutrophils is increased on a CBC, but it's really not. It's just a redistribution of neutrophils within the blood vessels. This is a transient neutrophilia, and it usually resolves within 30 minutes of an animal being removed from whatever excitement stimulus it was given. Also, it tends to occur more commonly in young, healthy animals, especially in young cats and horses. Catecholamines also cause an increase in concentration of other cell types or substances, particularly red cells, lymphocytes, platelets, and glucose. Stress neutrophilia can be caused by low levels of excessive glucocorticoids, which can be present in any sick or stressed patient, or it can occur with a marked pathologically high level of glucocorticoids, as seen in animals with hyperadrenocorticism, also known as Cushing's disease. In hyperadrenocorticism, the animal has a pituitary tumor or an adrenal tumor that's causing pathologically high levels of glucocorticoids, most commonly cortisol. Both stress and Cushing's disease cause neutrophilia, lymphopenia, and hyperglycemia, but results of other ClinPath tests can help suspect one process over the other. So, for example, Cushingoid dogs tend to have very high alkaline phosphatase activities, and those activities frequently exceed 4 times the upper reference interval. Stressed dogs tend to have a much lower alkaline phosphatase activity. Hypersegmented neutrophils might be seen on blood smear evaluation, and I'll talk more about those in the next lecture. Cushingoid dogs are also prone to developing unconcentrated urine and urinary tract infections. With acute inflammation, inflammatory cytokines produced at sites of inflammation are produced, and they make their way back to the bone marrow. And those inflammatory cytokines cause release of storage pool neutrophils from the bone marrow. And if the inflammation is severe enough, they'll also call on younger neutrophils from deeper within the maturation pool. These younger neutrophils have less segmentation to their nucleus, and they're frequently seen as band neutrophils. And I'll talk more about band neutrophils in the next lecture. Also, during times of inflammation, neutrophils undergo morphology changes, which is evident as neutrophil toxicity, and I'll talk more about that also in the next lecture. With acute inflammation, there also tends to be a lymphopenia due to sequestration of lymphocytes within lymphoid tissue. When inflammation persists, inflammatory cytokines at sites of inflammation stimulate the bone marrow to undergo hyperplasia. So there's an expansion of the proliferating pool and then eventually maturation pool as well. So while there is still maybe band neutrophils and neutrophil toxicity, like as seen as in acute inflammation, the mechanism for the neutrophilia with chronic inflammation is different. In contrast to acute inflammation, lymphocytosis instead of lymphopenia is seen with chronicity. And this is because the lymphocytes undergo hyperplasia in response to chronic antigenic stimulation. In general, mild increases in neutrophils, such as less than 2 times the upper reference interval, can be seen with any of the 3 main causes of neutrophilia. So that's physiologic neutrophilia, stress neutrophilia, or inflammatory neutrophilia. However, if the neutrophilia exceeds 2 times the upper reference interval, then inflammation is most likely present.